I'm Dr. Raymond Douglas of Beverly Hills, California and Los Angeles. Here today with Dr. John Cabot, and we're talking a little bit about thyroid eye disease and all the extra fat and contours that you get, and not just the eye bulging. So we've spent many videos with discussing the eye bulging associated with thyroid eye disease and how you can regain your normal appearance. But for people who are really interested in having a great outcome, meaning that they get back to their original appearance, it often goes way beyond orbital decompression or doing things to move the eye back. But you also have to think about the entire face, and that's where I asked Dr. Cabot, who's a facial plastic surgery, to join me so we can talk about a few of those issues.
Sure. Yeah, I'm happy to be here. Thank you.
So the first that we're going to talk about is a little bit about the lower eyelid bags. And we'll show you some before and afters and also some pictures demonstrating what we mean by this. And many patients get a bulge of their lower eyelids and around a ligament called the orbital malar ligament. And this ligament kind of holds back the fat that has expanded in thyroid eye disease and creates cheek bumps and bulges in the lower eyelids, and frankly my patients hate that. And there's a procedure that we can do at the same time as orbital decompression that is done a lot of times in aesthetic procedures, but we can combine it, where you actually take the fat and you move the fat onto the cheek to smooth out all those bumps. And it's an amazingly successful procedure, and that it can really dramatically improve the appearance without really much additional surgery. So I think it's really something that very few practitioners who do orbital decompressions will do, but it's certainly something to ask about, and certainly something that we do. What I'd like to talk about with Dr. Cabot a little bit about is something that's less well known, and that is when the cheek fat, the lower buccal fat, so like the chipmunk cheeks, or if you had mumps, that's what would be the fat associated in the cheeks, that gets big with thyroid eye disease, and it changes the entire facial shape. We'll see in a few photos of how patients go from a V-shaped face to a square face shape, and they hate it because it just doesn't look like themselves. You're not trying to achieve some unrealistic aesthetic ideal, it's just that you just don't look like yourself. So Dr. Cabot, tell me a little bit about what is a buccal fat and how can we potentially make that look better?
Absolutely. Yeah, I think you made a really good point about patients not looking like themselves after having this disease. And so I like to talk to patients about how to recontour the face, and the issue, as you mentioned, is buccal fat. Buccal fat is a fat pocket that sits in the face. It's unknown what its actual purpose is. There's probably some connection to breastfeeding in babies and potentially some cushioning of the muscles of the face. But regardless, in adults, it's really it's not been shown to actually have any purpose. And again, as in patients like this, the fat tends to grow. And so one of the things that we can do for this fat is a very simple procedure. Actually, sometimes can be done in the office under local anesthesia, where a little incision is made in the mouth, and through that incision, the fat can be removed. Depending on the extent of the fat, we can remove some of it or all of it. Usually you want to just remove some of it. And what that does, again, is it triangulates the face. In an ideal aesthetic, the face is a triangle, so it starts narrow at the bottom and goes out to define cheekbones. And so when you take out the fat that sits right here, especially for patients that have a lot of it, you can narrow that lower portion and create that aesthetic that a lot of patients lost when they had this disease.
Yeah. So for a lot of patients who don't have this disease, taking out that fat can lead to a little bit of an aging change, and so you have to be careful. But patients who have this disease, this fat has gotten 2 or 3 times as large. So often you can remove it without an excessive facial change, an aging change, but actually it dramatically improves the aesthetic appearance.
Absolutely.
Okay. And what's the recovery like for a surgery like that?
It's actually fairly benign. It's fairly easy. Patients will definitely get a little bit of swelling afterwards. Your cheeks may look even bigger than they were before in the short term, meaning about 5 to 7 days. And then after that, as the swelling goes down, you'll actually notice that the cheeks become thinner, and that you may even get some nice areas of definition on the cheeks, usually at the 1 to 2 week mark. Patients don't have to wear any special dressings. Usually pain medication is given, but it's not really needed, and usually a little bit of antibiotics is given just because the incisions are in the mouth. You want to be careful with that. But again, patients, this is one of the easiest, safest things we do, and patients really love the results. So.
Yeah. So it's certainly easy for Dr. Cabin, and we've done it together, and certainly do it in my practice. But many physicians, especially oculoplastic and orbital surgeons, aren't accustomed to working inside the mouth. So you certainly want to, ask and get a professional opinion, such as Dr. Cabin, before embarking upon this. And the fat tends to be a little firmer in thyroid patients, so it can be a little trickier. But nonetheless, it's an amazing procedure, and it really works well. And thank you so much for telling us about it.
Yeah, thank you. Appreciate it.